So he was very upset, right? And he was very hard to penetrate. Like, no matter how hard I was trying to.
It sounds so wrong when you say hard to penetrate, but yeah.
No, like, you know what I mean, right?
I know.
Like to get through to him,
yeah.
on a relatable level, it was like, wow, like I'm really talking to a wall right now.
Yeah.
Like,
This is Andrian.
And this is Ray. Welcome to the Talk Live podcast.
Every 2 weeks, we'll invite a new guest and
In every session, we'll dig into the life, relationships, and perspectives.
one question at a time.
Let's
talk la! Yay.
Welcome to the Talk La podcast. So in this series, we're actually gonna cover a lot of different Malaysian local stories. So right now we're actually recording in our humble home in Malaysia. And I think most importantly today, as our very first local Malaysian guest in Malaysia, we're gonna cover Kharenee Koh. And just a bit of background on how I met Kharenee, how I know, and the friendship that we've built. Basically, we know each other from our times in Singapore. We were hustling and really studying very hard in Singapore as Malaysian students. And I think the main point that I really wanted to get her on today, because she's been working for 5 years as a speech therapist. Yeah. And I think speech therapy is something that not a lot of people have experienced. It's quite a niche industry, right? So hopefully in this kind of episode, we really want to understand more about speech therapy for those interested listeners or people curious about it. And I think more importantly, your thought process, your mindset behind why you chose and what's your passions along the way throughout this. So there's a lot to cover. And it'll be an exciting one. So why not pass the time to you, Kharenee, to give a quick introduction of yourself, and then we can dive deeper into different perspectives. Yeah.
okay, yeah. So I'm Kharenee. As Ray was saying, I am a speech therapist. I previously worked in the UK for a couple of years, and then I recently came back to Malaysia, and I've been practicing here for about a year and a half now. So just very freshly coming back to Malaysia and practicing in a different country. Yeah, so currently I work with both adults and children, but when I was in the UK, I used to work with the geriatric population, so like the elderly population.
Mm-hmm.
So that's a bit about me. And
I think before going into more details about what you actually do and stuff, can you give a general introduction of what speech therapy What do you do as a speech therapist day to day, day in, day out? What do you do? What kind of patients you help? And just a brief introduction on what this industry is.
I think it's very interesting to talk about this because a lot of people, right, when you tell them that, oh, I'm a speech therapist, the common thing that people say is like, oh, you help people to talk. And then they're like, maybe I need speech therapy, I cannot talk properly, or things like that. Or a lot of people also think that, oh, it's just stuttering, for example, because of movies like The King's Speech, or, those kind of other movies where people see a speech therapist. But actually a speech therapist does very varied type of roles, and it's a very interesting job profession, well, in my opinion. So essentially what a speech therapist does is a speech therapist does all things to do with communication, and swallowing. So if you think about it, all the muscles in your throat that helps you to speak also are very similar to the muscles that help you to swallow. So that's kind of like what a speech therapist does. We see both very young children, so children from the pediatric side who cannot swallow, cannot speak, right? Or hearing impaired children who cannot speak properly, or children who have non-verbal communication, so special needs like autism or learning disabilities because they cannot access communication that way. So that's the side of pediatrics that we cover. And then we go all the way into adulthood, right? So young adults who have traumatic brain injury, for example. So people who had accidents or road traffic accidents or skiing accidents where they bump their head and it affects their language skills or their swallowing skills. And then obviously the geriatric population, so neurological conditions, so things like Parkinson's, motor neuron disease, dementia, all of the things that affect your brain, or a post-stroke, for example, like if you had a stroke, then it affects your language function, how you speak and how you swallow. So depending on the area of the brain that's affected, then how does a speech therapist come into play? So we work with patients to help them rehabilitate where they are, to help them access communication with other people, or to help them eat the food that they like, and help them swallow, basically.
Wow, okay. So if I'm trying to understand things correctly, it's actually very, very broad, right?
Yeah.
Because anything that relates to throat or like speech, in simple layman terms, speech, right? it would basically be part of your job scope.
Yes, yes.
So with that being said, right, like it's so broad, right? It covers from young children all the way to adults to old people.
Yeah.
And it covers from pediatrician, which is kids, to the neuroscience behind. So that's like more on the nerve sensing, how you pronounce. So
Yes.
it's really broad. And 5 years in this role, is there like a specialization that you're gonna work towards or planning to work towards where are you at right now?
Yeah, I think that is a very good question. So basically in Malaysia, it's very interesting because in Malaysia, speech therapists, once you get a degree, you can actually do both populations and find which population you enjoy doing. But actually my experience in the UK is that you do have to pick a specific population, and you can specialize by doing extra courses or going especially into a different specific field, for example. So for me personally, I have a passion and I love the elderly population. That's because of the reason is because my grandmother. So actually when I was a young kid, I think I was like 9, my grandmother had a snatch teeth accident. So in Malaysia, that's what happens, right? Like people will...
I don't mean to cut Kharenee off, but wherever you are in the world, right, I think just to give some context, Malaysia is really a really great place, but there are some aspects of Malaysia that is still not the best. For example, safety. Right? So this was like a long time ago. Now it has significantly improved, so it's a lot safer. But just to give some context to our listeners out there that, okay, Malaysia is actually a very beautiful country. It's a place where down the road I plan to be at. There's a lot of opportunities, but there are these kind of circumstances. So just giving a broader perspective for listeners out there that wherever you reside in the world, there's always good things and bad things. So back to Kharenee's story with the grandma.
Yeah, I definitely echo what Ray is saying. Yeah. So with my grandmother, when I was 9 years old, she experienced something called snatch teeth. So there was somebody on a motorbike who basically snatched her handbag, and then she fell and it damaged her brain. So it damaged the left hemisphere of her brain. So she had to go through a craniectomy, which basically means that the surgeon had to cut out parts of her brain so that she can continue functioning because it was so badly damaged. So as a result of that, she lost her speech and she lost her swallowing ability. So she had something called a feeding tube. So in Malaysia, they put it through the nose, but there's many different types of feeding tubes actually, which I was working with in the UK. But in Malaysia, everyone puts it in the nose lah. That's the most common one. So she had that, and it really affected me as a young kid, like seeing my grandmother do that, go through that lah. Yeah, so and then I saw her rehabilitate and things like that, but she still couldn't swallow. And so I started looking into it a little bit more, and it kind of like piqued my interest in speech therapy a little bit. So and then after that, I went into volunteering, and I was basically helping out with a church group, like where there's a learning disabilities group where all kids around that age
that in Malaysia or Singapore?
Yeah, it's in Malaysia. Yeah, so I was working out there, I was volunteering there, and then I saw actually there is a very lack of understanding of how to help this population communicate. There's a lot of help with their activities of day-to-day life, how to shower, how to do this and that, how to get them out and things like that. But what is going on in their brains, right? Like how are they accessing the world and how are they actually relating to the world when it's hard for them to verbally communicate or say it? That's something that's really lacking in our society. I would say even across the world, not just in Malaysia. Yeah, and then that just made my interest grow a little bit more. And then when I was in IB with Ray, right, that's when I was like, okay, actually, I think this is the profession that I want to go into. And then I talked to the career counselor about it. And I got to speak to a few different speech therapists as well. And that's what, solidified it for me lah. Yeah, essentially.
Yeah, I think it's... So just to summarize what you've just shared, I think it's just a really, really personal event that has taken place in your life.
Yeah.
And from that event, I think it really sparked that burning desire that, what's more to this that you can do better? Yeah. So I think it's very, very humbling that you kind of followed that intuition, right? When at such a young age with a personal experience that you went through and through your volunteering work, and you discovered that it's actually an area that you really, really want to make a change, right? So that whether it's old people, whether it's young people, but I think from your experience, it's really more for the elderly.
Yeah.
You really, really want to help them go through these kind of rehabilitation or process in a less painful manner.
Yeah.
And yeah, because I can, back in those days in IB, I was still pretty lost. Just to give some context, I just knew like I didn't know what degree that I wanted to focus, but knowing Kharenee, yeah, it sort of sparked to me that wow, okay, Kharenee already sort of knew which kind of area she wanted to be. And it was just really so niche that I didn't know what speech therapist was. She had to explain to many people, and that's why I decided, yeah, it might be a good topic to cover because it's really an untapped industry. Yeah, everyone is like going for doctor, lawyer, the standard status quo, right?
The
but
Asian.
actually, yeah. So I think that was a very, very personal. Thanks for sharing that story and going through that. I think I just want to end this point that actually, whether you are struggling to find what you want to do in life, it could be like a very personal experience that really gives you the motivation and passion to go deeper. And the community that you met, especially in the community service, so that sort of fuel you that, there's actually a lot of gaps and a lot more that you could do, and that led you and sparked your interest to further down. So it could be like a personal experience, or it could be, for my case, I think where I actually found some interest or passion is like really by talking to different people in the tech industry, and that led me like, actually it's a fun industry. So that just different ways that life comes at you, and you sort of went down that route. So closing that topic, I just wanted to ask like, okay, so that was how you actually stumbled and why you decided to narrow down. So it's really by a personal experience. Can you also share like the process, because we know that any sort of degree or profession, there must be like a very meticulous process, especially for speech therapy, because it's sort of medically and clinically trained, right? So can you just briefly share the process, the challenges? But let's start with the process first.
Okay.
What's the stuff that you went through to become like a qualified speech therapist?
So there is a process. You're right. So definitely, if you are thinking about doing speech therapy or you want to be in the rehabilitation industry, right, as a speech therapist, I think the subjects that you choose at A levels or IB is quite important for your admissions into university, right? So that's even starting way back in the college years, right? So I particularly enjoy language and linguistics, right? That's something that I actually quite enjoy. I hate math, right? So I knew I cannot do anything math related.
You're really good in literature. I mean, like, just to give some context, like Kharenee was like a standout literature student. I was struggling with literature because I was like trained as like a science,
your strength
memorize stuff. But then Kharenee's like essays always get shared out. I think it's like what Mrs. Wood, right? She shares out her example analysis of certain literature, and I'm like, wow, it's so proud being Malaysian in Singapore, and like
but I wasn't the best, but yes, I do enjoy language and I did enjoy literature. So that's definitely one aspect that you do have to enjoy as a speech therapist, because you're working so much with language function, right, and linguistics. So that's the process. You need to know what your interest is, and if your interest lies in language, this could be a profession. And also, if you love helping people, it could be a profession that you want to go into or you think about going into. And then also it's quite biology heavy as well. So you need to understand anatomy, physiology, some parts of neurology as well, because that helps to guide your therapeutic methods and evidence base. But as you said, it's clinical, right? But it's not 100% clinical. So there's a little bit of experimentation with it, such like many jobs, right? Some things work for certain patients and some don't. So you need to be quite creative as well to work with a client or with a patient to see what helps them and helps rehabilitate them. So those are the traits that I think encompasses a speech therapist, essentially. And then when you go into university, I think you need to pick a degree that suits you, right? So different university courses for speech therapy actually is very interesting. They focus on different aspects of speech therapy. Like some universities are famous for their research, right? But other universities might be more practical related. So whether you want to be clinical based or whether you want to go into the research of like the speech therapy methods or the evidence-based practice, that's something that you can think about as well if you're choosing your university degree, if you want to be a speech therapist. And then after you graduate, right, you have to go through something called the Health Professionals Council. That was when I was in the UK. So as a UK graduate, we had to apply to be part of the HCPC. And then you also be a member of the Royal College of Speech and Language Therapists, which is based in London. And then you have to go through an X number of clinical hours as part of your degree. And then you go into working as a speech therapist. So yes, you do have to qualify, and the degree is the minimum requirement. But as part of your degree, you do have to do X number of clinical hours before you can actually practice as a speech therapist. Yeah.
Is the degree is a requirement, right? It's a must-have.
Yes.
Okay.
You can't be a speech therapist without a speech and language therapy degree. Yes.
Okay.
Yeah.
Yeah, and I like that you brought up like, okay, because we touched on a bit just now, right? Speech therapy or therapist is very, very broad, right? And I was gonna ask like, okay, because you did mention it's like language and also very clinical. So to what spectrum, like you did mention there's different areas that you can focus, right? But I think like in general, right, speech therapy or speech therapists, where in the spectrum it is? Is it more language or is it more clinical? I would say it's clinical, right? Yeah.
Good question actually. But the answer to that question is actually it depends.
Okay.
Yeah. So depends on the client group that you're seeing, and it also depends on the condition that they have. So for example, if I'm seeing a patient that has language deficits, right, because they are a child, so it's a developmental problem. It's not acquired by a medical issue, then that will be very language based, because I'm helping the child access like the different semantic relations, or how to access language verbally or communicatively or writing or things like that. So it's very language and linguistics, because I need to know which part of language is difficult. But if I'm seeing a patient that is has a medical condition, or is a result of brain injury, or as a result of an acquired condition, then it's very clinical, because then I need to look at the doctor's notes. Then I need to understand like which part of the brain is affected. I need to know like which muscle is affected for their swallowing. Then it becomes very medical, if that makes sense.
Okay.
Yeah.
Wow. So actually, yeah, it all depends.
It depends.
But I think for your scenario, because I understand that now you're in the private sector, right? I can imagine, is it more on the linguistic side of things that is more common than the clinical side of things? Like, how do you like spend time in terms of your patient's dynamic?
Yeah.
Obviously, it varies depending on where you are stationed or which opportunities. But yeah, maybe you can share more from your side.
Yeah. So as a speech therapist, you can actually practice in a hospital, or you can practice in a private clinic, right? Like what I'm doing. At the moment, I'm working at a private clinic, and we also offer home visits, and we also offer hospital visits. So we have links with some doctors who allow us to come into the wards to see the client.
Yeah.
But if you're asking about like the percentage of where I lie on the spectrum personally as a speech therapist, I'm the speech therapist that see most of what we call a dysphagia client load. So dysphagia stands for swallowing disorders.
Very chim.
Yeah, it's not really this chim lah, but once you know about it,
Chim, by the way, is like it's a Singlish term, right?
Yeah,
Chim,
it's Singlish.
Is like very fancy.
Fancy word, yeah. But dysphagia essentially stands for swallowing disorders.
Okay,
so
okay.
yeah, but I cannot say like where it is, because it really depends.
You can't be picky.
Yeah.
And I think like
in the private sector, you cannot be picky.
But for public, you would say that it's actually more clinical, right?
No, it depends on
Oh, it
settings
depends on
still.
the- okay,
Yes,
okay.
it still depends on the setting. Yeah,
Okay.
but I really would say that it's a very 50-50.
Okay.
There's some speech therapists that really focus on language, and there's some speech therapists that really focus on the medical. Yeah, and at the moment, I'm still kind of doing both.
Okay.
Yeah.
So very broad and still quite generalist across the whole speech therapist kind of knowledge, right?
Yeah.
So I think that also because being in the clinical field, right, you always have to stay up to date with the latest knowledge, latest findings, or even best practices of teaching,
Yeah.
or helping a child or an adult go through the whole rehab process, right?
Yeah.
So how do you actually balance that time with your patients, and at the same time, when you find pockets in your life to actually upskill yourself,
Yeah.
be relevant?
Yeah, I think that's a very good question. So when I was in the UK, it was actually regulated that you have to have X number of continuing practice education hours. So that means that if you don't fulfill this number of hours, you actually cannot practice as a speech therapist, because you're not up to date, and you are not upskilling yourself, as what you say, right? But in Malaysia, there's actually very poor regulation for speech therapists. So what my clinic does actually, so we have links to a Singapore clinic. So every week, we actually have a topic that we're going to talk about. One person will lead it, one of the speech therapists will lead it, and then we will all learn from that person and have a discussion, whether it be a new clinical practice strategy, or whether it's like some new findings in evidence-based practice. And also, I think just having discussions, reading the most up-to-date, subscribing to like, the speech therapy related articles and paying for that subscription.
You follow a newsletter, that you keep updated.
Yeah, essentially that's what you need to do to be upskilling, right?
Malaysia,
as you
right?
say. Yes, in Malaysia it's
not a
very,
requirement,
very
right?
no.
Yeah, so guys, if you want to, live in a world full of gray areas, I think in general, developing countries as
Yeah.
opposed to developed countries would be the place that, you will find a lot of selok belok, like different
Yeah.
turns or different buckets where you can, exploit in some ways. Yeah.
Definitely, yes.
Okay.
Yeah.
That's good. And I forgot to touch on how long was the process for you to go through the whole degree, and then how long you have to practice, how many hours, and then you can
Yeah.
officially practice as an independent speech therapist. Yeah.
Yeah. So for me, my degree actually included the clinical hours within the degree.
Okay, wow.
So I was very lucky in that sense, where they incorporate the clinical number of hours and you go for what we call your placement, like your clinical placement. Then you have a senior speech therapist basically guide you, and you will see your own caseload and slowly build on your hours there. So once I graduated, I was able to apply for jobs already immediately. But I'm not so sure about how it is like for different degrees,
right?
yeah, in the countries, yeah. So the process is not that long for me, because once I graduated, I had a job already, and I just had to apply for my work visa, and then I started working in an acute hospital. So I was actually in a hospital setting in the UK. Even during COVID, I was actually working with something called the Home Enteral Nutrition Team. So it's all patients that get discharged with a feeding tube. And then I was meeting all of these patients outside the community, not in the hospital anymore, and helping them rehabilitate their swallowing there. So it was a very interesting caseload at that time. Yeah.
And I think we're going to touch, how COVID have changes this whole industry. But I think before that, we've covered, how the whole process, why you step into this industry, your passions for it. But I also wanted to touch, I think it would be good to cover, what's some of the great things, the upside, the downsides, what are some of the challenges that you face being in this industry? What kind of trade-off that you have made? Yeah. So it could be within your work, or maybe outside, like, well, there are different opportunities. What kind of trade-off that you have to forego just to be in this industry?
Yeah, okay. Good. Let's talk about the upside first,
Upsides,
because that's
yeah.
always fun, right?
Always nice to hear about the positives. Right?
Yeah, I think the upside obviously is the job satisfaction, and also I think the feeling that you're giving back to the community. Seeing my patients grow from something that is like they're unable to swallow, or they're unable to speak, or they're having word finding difficulties, they cannot communicate with their family, and then getting to know them on a personal level and working with them and their families to rehabilitate them to where they are now, that's the most satisfying thing ever, right? So that's the biggest upside for me. And I think just meeting like what you like to do, right, Ray, is meeting new people and like listening to their stories, like their life experience, like learning new things from them, from different cultures, and I get to do it on a very personal level because I'm entering their home. I'm seeing their loved one, right? And I learned so much from that experience. Yeah. So I actually wanted to share one story that I had in the hospital.
Okay.
And this was before COVID lah. So I was actually seeing this patient. He had a tracheostomy. So it's something that a tracheostomy is basically where you cannot breathe on your own.
Okay.
And you have to put a hole in where your neck is, right? So you become a neck breather. So as a result of that, because your hole is here, you're not breathing from your mouth or your nose, you end up cannot speak because you can't articulate. There's no airflow in the front. So this patient I was seeing in the hospital, he was very depressed because first you lost your ability to speak, right? You cannot swallow as well because you have a hole in your neck. And then secondly, like, you're going through so much, you're in the hospital.
Wait, so he's on a liquid diet, right?
So he is on a feeding tube.
Okay.
Yeah. So he cannot swallow at all.
So it's a liquid diet, right?
Yeah, liquid. Yeah, you're right. Yeah,
Okay.
liquid. So I went to see this client because I needed to see him for whether he can start breathing again. So we had to occlude his hole and see if he can breathe, and also see if he can speak. and also
Okay.
assess his swallowing.
Okay.
Yeah, so those are a couple of things I was doing. So this patient, he was very, very funny. So he was very upset, right? And he was very hard to penetrate. Like, no matter how hard I was trying to
It sounds
draw
so wrong when you say hard to penetrate, but yeah.
No, like, you know what I mean,
I know.
right?
Yeah, I know.
Like, to get through to him,
Yeah.
on a relatable level, it was like, wow, like I'm really talking to a wall right now.
Yeah.
Like, and I'm quite a cheerful, bubbly person,
Yeah.
but he was testing me. He was really
Wow.
testing me. But something happened during my assessment which broke a smile from him. So I'm going to share this, and it's
Wow,
actually quite
okay.
funny and embarrassing, but I think it's a very nice story.
Okay.
So he cannot mobilize by himself, so he cannot get out of bed to go to the toilet.
Okay.
So in the hospitals in the UK, they give you a little bottle for you to pee into.
Okay.
Okay. So he probably did it before my assessment,
Yep.
and he put it on the chair next to his bed. And I was not aware of that. So as I was doing my assessment, I wanted to get down to his level and like be face to face with him. So I sat on the chair, and that bottle of pee was there, and it like went all over me. And then he started laughing. And finally, right, when he started laughing, I managed to do like such a great assessment with him.
Yeah.
At the expense of my own embarrassment, right?
Yeah.
So I had pee all over me and stuff.
on his, yeah.
Yeah, so it's this kind of stories that you cannot make up when
Yeah,
you're a speech
yeah,
therapist. It's
yeah.
something you have to go through. Like, what the
Yeah.
heck? Yeah. So, but because of my embarrassment, like I managed to managed to get through to him, and I managed to have a very successful assessment with him, right?
Okay, okay.
And as a result of that, he became very happy to do rehab with me. Yeah. So I feel like these kind of stories, like there's so many different types of stories that I can
Yeah,
share, but
yeah.
this experience has stuck with me for such a long time because I found it really funny. Yeah.
And now you can
Yeah.
say, like, as part of your job resume that you sat on pee.
I've sat in pee, right? And
Yeah.
just for the for my patient.
I think that's very good, and I think thanks for sharing this kind of funny type of stories.
Yeah.
It shows like on the job there's a lot of different kind of scenarios that would it depends on
Yeah.
the person. I think you're bubbly and positive, right? The fact that you sat on pee, some people will be like disgusted
no.
and make it like the worst thing ever in
Yeah.
their career. But for you sort of like
Yeah.
adapted and capitalized on that. You saw him smiling, and then it became one of the
Yeah.
breakthroughs that you
Yeah.
could have a very successful assessment. So I think it also showcases like what kind of person you are, and the mindset of approaching things really affects
Yeah.
the outcome.
Yeah.
And I also want to touch the point that you did mention like one of the biggest upside is to find something that you're very satisfied doing. Right. So I think yes, I think that's what the end goal. It's very important to find something that at least you don't hate,
Yeah.
but you love doing. That's really a big plus.
Yeah.
Yeah, and we're all going through that process as a young adult, whether we've dived into a career or industry that we're in. I think what I've took away like from you is like, okay, job satisfaction is important. It's important for me, but I think what I really like and hear from you is that you're not just satisfied of the job, you're actually more a part of their life and seeing the whole. So it's really not just satisfaction anymore. It's really the value that you provide to society. There's some sort of impact that you do that. So I really think like, okay, if you think about work and finding fulfillment, that's also very an interesting perspective. Like if you can find some ways to really story tell to yourself or internalize that, oh, you're helping a customer grow their business and see what kind of impact.
Yeah.
So I think it's really like from your sharing, I just couldn't help but think like it's important to have this kind of notion or mindset to everything that you do, because there's gonna be some sort of impact that your current work
Can
is
make.
driving to society. Yeah.
That's a really good point. Yeah, to add value, right, to the
Yeah.
people that you encounter.
Yeah.
Whatever job you do, I think
Yeah.
you can do that.
Yeah. So that was upsides, right? What about
Yeah.
the downsides or challenges that you know you're comfortable sharing about the industry overall, or like down to a specific experience? Yeah.
Yeah, I mean, like every job, there's always downsides, right? And
Yep.
not just in the job, but in life, right?
Yeah.
So I think some downsides, specifically when you're working with the elderly population, is they may never get back their function. And they may end up also passing away. And you have built that relationship, and you have to have that strength to not just support the family, but also like have that strength to carry on, right? Because you invest in a patient and you want them to do well, but they may never end up doing well, right? They may never end up swallowing again, or they may actually end up dying, right? Because of their other medical conditions. So that's one thing that I really found very, very tough in the beginning, because as a naive, like, you know, fresh grad where you see everything is like so great and you think like, wow, I'm gonna help all these people.
Yeah.
And whatever you do, no matter how much you try and do it, it actually doesn't help, right? And actually there's so many other things that and many other factors that contribute. Yeah, so that's one of the biggest downsides. The other thing also is that, I mean, you don't get paid a lot as a speech therapist, right? So you don't go
Okay.
into the job thinking that this
You're
is
gonna
going to
make
be
your wealth or pot of gold
yeah.
from this.
Yeah, it is really something that is a very fixed kind of like salary and your pay scale, and that is something that you have to get used to, right? Depending on the lifestyle that you
Yep.
have. Yeah.
Yep.
And I think the last thing is also managing a lot of different expectations. And I think I shared that with you
Yep.
as well, right? Is that speech therapy is, like you said, very niche, very new. Not many people know about it.
Yeah.
And it's advocating for the profession and trying at the same time justifying yourself, right? So
Yep.
sometimes I also feel like because people don't know about it, they look down on it, or you know, they talk about it like, oh, does it really work? They're very skeptical about
Yep.
it, right? There is a lot of evidence behind it, but people don't know, right?
You need to prove yourself
Yeah.
all the time, right? And what's the
Yeah.
value that
Correct.
you can provide through the process, right?
Yeah, and people are not trusting of that, then they end up just distrusting it, and you feel very like it impacts your self-esteem. Yeah, so those
Yeah.
are the downsides, some of them.
And just touching upon like, because I think I've had, I think everyone have went through like some close friend or family members going through death, right? So I think in your industry, especially, you really love to deal with elderly people, right? So at the, like what you rightly mentioned, right? Like it comes as part of the job. So how do you deal with all that? You mentioned like initially you struggle a lot.
Yeah.
And it mustn't be easy because at one point, like, I don't know, like for me, it's just a weird feeling like on one day you can be spending time with someone
Yeah.
and one day like they're gone and then you're like,
Yeah.
oh, you sort of never said, obviously it's like a profession and you treat them,
Yeah.
but you sort of build like that personal touch. And
Yeah.
once you know someone personally and then they're gone, it's just a very weird feeling.
Yeah.
Right?
Yeah. I remember specifically how I felt when my first patient actually passed away.
Yeah.
So I
Was that the toughest or?
yeah, it was a shock to me because
Yeah.
I've never experienced it
Yeah.
before. Yeah. And I know it sounds very naive
Yeah,
to say that,
yeah.
but yeah. So when I first started working in a hospital, like in a hospital, everyone's very, very ill, right? That's why they're
Yep.
staying in a hospital. And I built quite a very nice relationship with this patient. She had a lot of problems, but she was very lucid. And this is very important in a patient because some patients that come in, they're not lucid, they cannot talk to you, right? But she was conversing with me, like she knew my name every time I came to see her. We had a very nice relationship. And the day before that, I saw her, we had a great time. And then the next day, she, you know, I went to look for her at her bed because like it was time for her review and she was gone. Like it was just like, what, like, are you serious? Like,
Yeah.
wow, what happened? Like, right? And what really helped me was, you know, my colleagues, obviously, right?
Yep.
They've all been through it many times.
Yep.
And it's not that you get used to it, but you start to realize that you're not looking to just help them, but you're also making the times that you have with them count. So
Yeah.
because we meet so many people in a day, and sometimes it can be very tiring because, for example, if I'm seeing 7-8 patients in one day, they can just become a number, right? And you're not making it personal anymore because you need to get through your list. You want to
Yeah.
get through the day. You want to make sure that you see all your patients on time. But what one of my colleagues told me is like, and which I really hold to my heart right now, and I forever hope that I will never lose this,
Yeah.
is whatever time that I have spent with this patient, I want them to know that this time is theirs. And I'm not gonna, you know, I'm gonna try and make it as personal as possible for them at that time. So even if that's the most limiting time that they have and they might end up going the next day, at least the encounter that I have with them counts, right? And
Wow.
if it be like the swallowing, right? Like at least, you know, I managed to give them a drink before they pass away. Like that's how I comfort myself.
Yeah.
But I think also it helped me in my profession to get used to the fact that, yeah, not everyone is going to recover.
Yeah.
Yeah.
I think that's it's all about finding a methodology or framework or personal, like I think this is like one of
philosophy,
your
right? Yeah.
philosophy or principle that you have got from one of your colleagues that have went through.
Yeah.
And I think it's a very humble and also shows like, it's very caring. Like you want to provide the best kind of service and make sure that even though it's the last time,
Yeah.
that they are in the comfort of someone's hand and they get the full attention. And
Yeah.
I think this can be applied to
Anything.
like I think anything in life, right?
Yeah.
Of course, more so in like very frontline customer facing kind of thing. But if you think about any roles that you do, right? If every conversation that we have with a particular stakeholder in whatever industry you have,
Yes.
oh my God, I can imagine life will be so much more beautiful that way. But of course, that's the optimal world. But thanks for sharing that kind of personal experience and story. And I think I think we're like, just to run through two more points before we close the podcast. So I think we mentioned a bit about COVID have changed many different industries.
Yes.
And we also thought about there could be good opportunities, downsides. Yeah, maybe you can share how COVID have actually helped accelerated opportunities for you, and what are some of the downsides? Yeah, you can just and we can see
how it goes, right?
Yep.
Yeah, I think when COVID first hit, it was a shock to a lot of frontliners in the hospital setting. I was working for a hospital, but I was going in the community at that time.
This was back in UK
in
or
the UK. So
okay.
I was actually working in the UK when COVID happened. In London actually. So I just accepted a new role. And it was
in Kent, right? I remember.
I was in Kent at first, and then I moved to London.
Okay.
Yeah. So then I just started in London, and then COVID hit.
Okay.
And there was a lack of PPE. There was like a lot of like stress in the NHS.
PPE, for those that don't remember, is like protective personal
protective equipment.
Okay, I'm not expert. PPE for you guys.
Yeah, and it was very stressful because as the NHS, right, you already have so much stress. On top of that, you have this like pandemic happening.
Yeah.
And actually, it does affect speech therapists a lot because COVID is a respiratory problem.
Yeah.
Which affects your breathing, which will affect your swallowing, and will affect your speech and your voice. So we actually had a huge influx of like referrals at that time, but there was not enough PPE. There's not enough knowledge about COVID at all.
Yeah.
And as speech therapists, we're not doctors. We also need to know like what's going on, right? And it was very tough at that time. And I was working every day, and I found it very, very difficult because all the things that I enjoyed about my job became very scary to me. And very stressful. So that's what happened at first. Then, of course, gradually when things started, you understand more about the condition, there's vaccinations and things like that. And amidst all that, I actually moved back to Malaysia and I started working for the private clinic here, right, in Malaysia. So we did things like online therapy, which is very new. It's not something that is very, it's extremely new. So it's definitely something that happened because of COVID. And as a result of that, I'm actually seeing patients like outside of Malaysia, and I no longer just narrow down the people that I see to just the community that I'm in. So it definitely accelerated in that sense, and people can get access to therapy wherever they are, depending on the condition, obviously, right? Some you're not able to do it online, then you won't, but definitely it helped me change my perspective as a speech therapist, that I don't just need to see the patient physically, we can actually do things online.
Yeah. So a lot of obviously there's always two sides of a coin. Initially people will just react, there's a lot of bad things, but on the flip side, there's a lot of opportunities that can come up from it. And I think just to because I look at the time, I just want to it's an interesting conversation, but I think like just one last point on yourself, that what have really stayed true to yourself that really have helped you through that journey that you wanted to share to the people out there.
I think we kind of touched on it already, but definitely one of the things that really helped me is my faith, right? And my trust in like God, and I believe that he helped give me that strength. But I think very important is that philosophy where you make every moment count with every person that you meet. That changes your perspective.
I completely resonate. It could be faith, it could be a particular philosophy that you stay down to earth, but you need to anchor your support system or mindset to something. It could be family, it could be friends, something. So hopefully this episode with Kharenee was helpful, and you've got like a lot of insights around speech therapy, this whole industry, the process, the challenges that you will be facing if you do end up. But there's definitely a lot of upsides, and I think if you'll be interested, I think I'll drop like Kharenee's details or whatever. And I think do stay tuned to the second part, because I think it's also more on Kharenee have experiences of working abroad, and then she decided to come back to her local country in Malaysia. But that could be the case for anyone wanting to work abroad. So I think we'll do stay tuned for the second part with Kharenee. And once again, thanks very much for your time, and thank you, Kharenee, for sharing such a personal and insightful story about this whole speech therapy. I've learned a lot, and I'm sure the guests will too.
Okay, thanks for having me.
All right, bye-bye.